Hello, everyone. Thank you so much if you're watching this for participating in the 2021 Kentucky Refugee and Immigrant Inclusion Summit. If you're here, it's because you're interested in helping make Lexington as inclusive and welcoming as possible. And on behalf of Kentucky Refugee Ministries and the community of organizers who worked on this, we're really grateful to all of the participants and viewers of the summit today. I'm Mary Cobb, I'm the director of KRM Lexington, and I really am privileged and honored to be with a special guest today who's joining us, Dr. Rajiv Bais. Oh, I hope I am saying your name correctly, please. Thank you. Is here with us. Let me have you introduce yourself, Dr. Bais.
My name is Rajiv Bais, and I run a clinic called the Carolina Survivor Clinic in Columbia, South Carolina. And we take care of refugees, focusing in on survivors of torture.
Really an important task and important work. And for those who don't know, we in Lexington, in January of 2020, opened a Survivors of Torture Recovery Center in partnership with U of L. There's already a center in Louisville like that, and I think you know them pretty well from your past. So we are learning lessons here in other parts of Kentucky as we try to really make sure that these services become more broadly available outside of Louisville as well. So I've had the honor to get to know you a little bit through some of the sessions we've had, and I just thought it would be really good for more of the public and our participants to hear some of your wisdom. So thanks again for doing that. At the end of this or somewhere, we'll post some more information about the Lexington Center so that hopefully if people need to find us, they can. Maybe just to get to know you a little bit, I would love our viewers to hear a little bit of your story and how you got into this and kind of what drew you to it and why you're doing it.
You know, for me, it's a little personal. You know, I come from India, and the area of India I'm from, there's a lot of fighting, civil strife, and sort of religious conflict. And so my family was involved in that and victims of that. So it sort of affected me growing up. So that sort of led me towards that, and just working, you know, that's sort of why I went into the work and got myself interested in that. And it's very personal for me. So, but you know, it just working with people and is what I enjoy. So that's how I got into it, really.
Thank you for that. I hope that didn't catch you off guard. Just to get to know you question, but so can you also kind of for those who haven't really worked in this field at all, kind of define a little bit about what is torture? What are we talking about that some of our clients have experienced? You don't have to get too graphic, of course, but just sort of the parameters.
Sure. I mean, like, what is torture? That's an interesting, everyone has their own definition. Some people are more formal than others. You know, refugees, working with refugees and victims of human trafficking and asylum seekers, you're going to see that not everyone has that formal definition of being what you think of, which is, you know, being imprisoned and tortured and formally tortured by a political agency. I mean, there's many people that have lived through wars and trauma through wars, and have seen and experienced the horrors of that and the horrors of persecution, that I still consider torture survivors or trauma survivors. I think it's one and the same. So my definition is very broad, and I consider people who have lived through conflict and have suffered because of it. Those are people I consider trauma torture survivors and victims. So it's very broad.
Yeah, I think even in the stricter, like the federal kind of definition for those programs, I was surprised and pleased actually to know that witness to torture is also included in, and the federal funding and programs that they support actually are pretty inclusive of a little broader definition than I thought maybe at first before I really looked at it. So um, we do have at KRM Lexington as the resettlement agency, quite a number of clients who are coming in with, witnessing or directly experiencing themselves and their families, those types of things that put them in some distress and some need, after they get here. And we find that a lot of times right at first, when people arrive, there's so much adjustment, right? And there's a new apartment and getting your kids in school, finding, how to get everywhere, how to ride the bus, all the stuff, that it's a little bit on the back burner. All the trauma, it's there, it's never going, it's just going to disappear. But right now it's like, where do I, get on the bus, and how do I pay my bills and all of that. So what we have found is that, sometimes it's a year or two later, people are doing well at their job, they're kind of settled, and they might come back and say, I'm ready to deal with this now. It's really starting to kind of resurface. So I think of maybe people who are familiar with refugee resettlement, or who maybe in their community group or their teachers watching this start to see resettlement, and families settling in, and they think, well, it's going to be smooth sailing from here. And that's not always the case. And I think sometimes that's a surprise. So I don't know if there are things you could talk about in that regard, about what patterns might be like, or why things resurface later, or why we shouldn't be surprised or worried if this resurfaces later.
Well,
anything you'd say about that?
yeah, the way we approach it is a little different than a lot of centers. We don't really ask about trauma too much. We don't really directly ask. We don't do any questionnaires about trauma. We don't really formally sort of probe for it. What we like to do is we like to get to know a person and see who they are. What are they all about? How are they feeling? What are their problems? What are the things they like? What are their family like? What's their community like? And what are the things that are bothering them, right? And then over time, and that can take months, it can take weeks, it could take years. I might never get a story, which is okay. But over time, we get to know a person, just like you get to know a friend over time. And then the stories become more clear, just like you get a story of your friend, or you get to know somebody. They enter your life, and over time you get to know them, and you get to understand what makes a person click. So yeah, that's how we approach it. And I think a lot of that takes time. And of course, like what you're saying, people might present with very innocuous complaints, very subtle complaints. And that's okay. It might take, like you said, they might be here for some time in the US before anything presents, or it might present early, whatever, it doesn't matter. It does take, it it's not easy to explain what you've been through, and we understand that and we respect that. So our goal with everybody we meet is to give them space, give them respect, and give them a lot of friendship and love. And then once they trust us and like us, then we get to know each other. They get to know me, and I get to know them, and then we'll figure things out together. That's how we approach things.
Yeah,
Is that
thanks for
answering your
sharing that.
question?
Yeah, I love that. That's what I had in mind because I had the privilege of meeting with you before, and that stuck out to me, at how really person-centered, I guess, is the buzzword term that would be used for that now, but that's your style really is humanizing, and I think that's just something to applaud. So I appreciate hearing
You know, we don't really like to label people, you know, I like to label things, but people are people, you know,
Yeah.
they have names and they are who they are and everyone's different. And, you know, we just approach them like we would any other person on the street, you
Yeah.
know, meet. So
Well, I think that's also helpful because, to the people watching this who are, again, like teachers and volunteers and neighbors and church members, people who just want to, be supportive. Um, it's daunting even for clinicians or providers when they hear the word torture. We had been talking to some different providers about maybe working with us, and a lot of even, really experienced therapists were like, I can't do that. I don't feel qualified. I don't know how to do it. They felt really daunted. And I think that's true of a lot of people. And so I think to, maybe look for some advice from you about that, of like, just treat people like humans and be nice, be good to them. I mean, I don't know. I don't want to put the advice in your mouth, but what would you say to that? How do you, kind of
yeah,
advise people if they hear someone mention, like in their English class or in their whatever, just as a neighbor, like some mention of a past trauma? I think people freeze. So what would you advise?
well, I can understand that reaction too. It's not something you encounter every day, but it's not also something you can take away. It's an experience that this person has. It's quite profound, but we've all had profound experiences, right? This is life. It's part of life, but this person is still a person. So getting to know someone doesn't, I mean, you get to, you approach a person with respect, just like any other person. So I'm not labeling my patients as patients. I don't label them like that. I don't label them as torture survivors or refugees. I label them as people and friends and family, really, you know. Um, Once you start approaching someone in that provider, patient, or that sort of scope, the playing field is not level, and you'll never become friends. You'll never understand that person in depth. I'm sorry, but maybe you will. Maybe I can't. Um, and I think it's not hard to understand a person, right? So once someone trusts you, so for example, if I trust someone, a friend of mine, and I feel like I have to talk about what I've been through, I'll tell them, and I don't expect them to say anything to me. Just listen to me and be like, "Oh my God, I'm so sorry. You know, I'm here for you." Right? I think when you encounter someone with torture, especially people in the community who want to help, I think listening is key, and listening full-heartedly. Okay, not with an agenda, not with like almost a savior type attitude. Then that playing field is off. You know, it's not, the reasoning is phallus. It's not correct, right? Why are you doing it? Are you doing it to save a person, or help, or are you looking to just help a person? Or are you looking as that person as an equal and a friend? Once you start looking at them as an equal, which they are, then it becomes a lot easier. So that I wouldn't be daunted. I wouldn't be scared. People are people. I mean, we have 7 billion people, 8 billion. I don't even know how many billion. A lot of people on the planet, and a lot of people have lived. And you know, just like I'm getting to know you, Mary, and you're getting to know me. You know, be real. I think, don't be scared.
Yeah, I think, as you say, if someone trusts you enough to bring it up or confide, then that's a strong sign that they feel some trust already, or some degree of closeness with whoever they're talking to. So,
But I'm going to tell you, it's going to take time, and effort. Just like you don't see your friends for 15 minutes or 30 minutes every 3 months. You talk to them, right? You get to know them. You get to know their family. You get to know where they work. You get to know, what's good in their life, what's bad, what's cool, what they like, and they get to know you too, right? It's a two-way street. That's the one of the problems with the way we're taught medicine here, is that it's never a two-way street, and it's always on an unequal playing field. That doesn't work so well. Um, so it takes a lot of give and take, I think, a lot of friendship. Friendship is two ways, right? Yeah.
is there some principle of, I guess, do no harm, maybe, that people should think about, if someone decides to confide to a new friend, a teacher, or whatever? Can you talk about that? Is it like, should you
I
not ask questions? Should you ask questions? Do you just say supportive things and listen, as you said, is the biggest, but
I think yeah, do no harm. I mean, don't have an intent to harm. So you ask a question. Someone brought up something and they want to talk about it. So you ask a question. The the intent is not there to harm, right? Just like you talk with anyone else. I mean, it's just a conversation, right? Um, I personally don't ask about trauma, because just like I wouldn't ask someone I meet from, say, for example, Punjab, where I'm from, or Burma, or something like that. I wouldn't say, hey man, were you tortured, or did they rape you? Hello, I'm not gonna be like that. I'm gonna be like, hey, oh man, you're from Punjab, I'm from Punjab. Or you're from Burma, oh, I'm from India, we're neighbors. uh I get to know them just like anything else, and it takes time. So if someone's talking to you about what they've been through, it's okay. That's what they want to talk about. Just like if you talk to someone about, you know, your day and it's horrible, or something that bad happened to you, that's what you want to talk about. It's okay. Do no harm is, I mean, like when you ask these questions for a certain purpose of yours, right? What are you trying to, what are you trying to get out of it, right? Should you be getting anything out of this? Probably not. It's more of like, what is your goal in this relationship? And so I think, when you're treating people, treat them like people, and have those real conversations. It's okay to talk about it. You know, I wouldn't probe, um, but if someone brings it up, yeah, talk about it. They want to bring it up for a reason, right?
I just love talking to you, because I think you kind of just reinforce that all of us, have the tools to be good neighbors, and it shouldn't be some kind of fear to be like, oh my gosh, I'm gonna mess this up, or that what you're describing is just like being a good human, and caring about other people and listening. So
Yeah.
yeah, I'm just so glad that you can, kind of validate that for people, that
I think putting yourself in someone else's shoes is not hard to do. It, but people don't do it, right? Enough. Even myself, I get guilty of that. I don't do it enough. But that's what you need to do whenever you're with somebody, right? Um, it's just you keep it real. Don't be afraid. People are people. That, trust me, torture survivors have been through a lot more than than asking questions when they bring something up. So don't be afraid.
yeah, that's a good, like, sound bite. I might rename the session. People are people, keep it real. Would you mind if you have just a couple more minutes to share any stories? Obviously, nothing identifying to anybody, but about clients you've seen or patients or people, I should just say, who have come through some of the difficulty of adjustment, or who have found kind of a place where they feel more peaceful or content or able to kind of move forward as a result of getting some support from you or a program like yours.
Well, I think there's a lot of, we have 700 patients in our clinic, and the way we do things is a little different. When I say clinic, we have a lot of home visits. We have a garden that we is in the main apartment complex where people live. We have adult English classes that are held in people's apartments. So volunteers go to their apartments on people's own schedules. We have a tutoring program that uses soccer as an incentive. We have weekly women's groups. So when you say the people have done positively, people do positive, people are good when there's support in a community, when they feel comfortable, when they feel at peace, right? They may be dealing with the most horrific experiences ever. That you can't take away, right? I'll never be able to take away those experiences. What I can do is be there for a person, make sure that the community is there for that person, make sure that there's a lot of love and support for that person, and try to foster that. So there's nothing I do individually that's gonna make someone better. It's what we sort of do as this Columbia community, and the different community group, or the different groups that this person belongs to. So for example, our people who are Korean, they have a very big support group, and we encourage people to check on each other, have parties, get together, laugh, that sort of thing. Same thing with our Congolese population, same thing with our Afghani, so on and so forth. We encourage people to support each other. So I don't know if there's an individual case, but I do know a lot of people are happy, and a lot of people have support, not just from me, but from the community itself. And we encourage that a lot. And that's how we get people to heal. So nothing I do. So.
Well, I would say you might be a little bit too humble, because I know that you are putting pieces together, and that encouragement that you described is a credit to you, even though I know that you are not looking for credit, but I'm sure that helping bring it all together is still pretty useful as a support. So I guess I don't know, any plans to come back to Kentucky and maybe visit us, or
Yeah, I'm Punjabi, so I like bourbon.
okay.
But yeah, I love Louisville and Kentucky. So I had some great memories there. Jim and Babuti. I don't know if you guys, people who are watching this will know them. They're wonderful people. So I had really great memories. I don't know if I'll actually come back to live there. That's up to my wife, whatever she
Maybe a
wants.
visit.
But definitely to visit. I think we have a lot of good friends here in Columbia now, and so if anyone wants to visit, please feel free. It doesn't have the good food that Louisville has. It's
In
hard.
Lexington.
And I haven't been to Lexington. I've never been to Lexington.
Okay,
but
we'll have
the
to.
invitation's open, so please.
Yes, we'll have to try to make that happen. I'm actually here in our new KRM Lexington office this is one of the rooms that we'll be using for some of the services like the ones we've been talking about, other programs as well. So lots of natural light. You remember you explaining the need for natural light and being able to see the door, and we try to really make it as comfortable as possible for everyone, not just for specific kinds of clients. But we'd love to have you, maybe next year's summit, we'll be back in person and we can kind of get you to come up and give us your thoughts about what's going on here. I think it's really been great to learn from some. I know, again, you're so humble, but you are a leader in this field. You've done a lot that we can all learn from. So your eyes get big, but I just really appreciate hearing from you and thinking through how we can be always doing things better or differently or more humbly or more openly. So that's the vibe I get from you, and I really admire it. So
thank you, Mary. Thank you so much for having me. And I can't wait to see all the great things you guys do, and whatever I can do to help, I will. But thank you so much.
All right, thank you. And for those watching who want to learn more about this, you all probably know KRM if you're watching this already, but our website and our social media has tons of info. We do accept client referrals. If you are a health provider and you need to send someone for some support, we have a lot of supportive programs. Just get in touch with us and we can take it from there. So thanks to everyone and enjoy the rest of the summit.